Good afternoon, dear students. We are together again, and my name is Professor Starchik, and we continue our lecture course. And today's topic is the heart, the main organ in the human body. I hope you have a good connection, and if so, I'm ready to start my presentation. Just let me know about the quality of the sound and the speed of translation. I see, yeah, thank you for your quick feedback, and let's open the dialogue. The lecture will be about the functional anatomy of the heart. And this is very important because it is not enough to understand just and only anatomy of the heart. When you will be doctor, when you are doctor, it is necessary to understand how the heart works. So we will talk about function, not only anatomy and function of the main organ, and I'll give you some interesting fact from the clinic, and we will also talk about the development on the heart and some problems which will be if the development is going wrong. So first, what I'd like to say that the heart is surely the most popular organ, because even children have an idea of the heart and its location. The heart is sensitive to the emotional state of a person. Therefore, it's endowed with the special properties that it doesn't possess. It means that some people think that heart has some function what it can't carry out. You probably know some expression: the heart trembles with joy, shrinks with pain, freezes with fear. Many lyrics call the heart the organ of love. Also, doctors have a completely different opinion on this matter. The heart is the most important organ in the human body. It is the first organ to show signs of life in the embryo. When the heart stops, almost instantly death occurs. Knowledge of the structure and function of the heart is very important for doctors of all specialties. A thick heart has long been the subject of conference study. Cardiac surgery and interventional arrhythmologists are the part of medicine which are very progressive. A long time ago, heart-lung machine was created. Cardiosurgeons often carry a heart transplantation out, and that is typical for today's. New types of artificial heart valves are being produced. However, paradoxically, doctors often know much less about a healthy heart than about a sick one. But just good knowledge of the anatomy and physiology of a healthy heart will make it possible to find new effective methods of treatments and prevention of cardiovascular diseases. I like the expression of great Russian doctor Sergei Botkin, who said, "When I attend the autopsy of a person who died of a heart disease, in half of these cases I cannot understand what he died of, and in the other half of the cases, how he could still live with such heart disease." That's very interesting, and it shows that our heart works very, very hard during whole life and help us to survive. Here a picture with the cardiovascular diseases, and you see that heart diseases, this and this takes more than 50% of all cardiovascular diseases. It is interesting also that now the cardiovascular diseases and diseases of the blood vessels we call as the killer of the humanity number one, because according to the World Health Organization, among the adult population of the planet, approximately 29%, it means every fourth person, die from cardiovascular diseases. Mortality in diseases of the heart and blood vessels remains the highest, and today, as you see, it is approximately 50%. So it is very important to know anatomy and physiology of the heart to be a good doctor. Today we will talk about internal and external anatomy. We will also talk in the end of the lecture about development of the heart and congenital malformation of this organ. Let's start from the internal anatomy and organization of the heart. First of all, the heart is the central organ of the cardiovascular system. and it has two names: cor, Latin, and cardia. It's mostly the Greek name of the organ. Видите, я читаю лекцию, я не могу сейчас, извини, потом перезвоню. And as you see, these organs carries out the movement of the blood in the body through constant rhythmic contractions. It means this is a contraction, it is the main part of the function of the heart function. And except heart is a part of the cardiovascular systems, there are blood vessels and lymphatic vessels. As you see, arteries and veins are blood vessels, which is a difference between arteries and veins. The blood vessels that carry blood from the heart are called arteries. They take blood from the heart and transport it to the organs. Veins, these vessels carry blood to the heart, in the direction to the heart, and that is also blood vessels. We will talk about arteries and veins in our next lectures. Which shape does the heart have? Outwardly, the heart resembles an irregular cone, and this organ, I mean heart, doesn't look like the one painted on the Valentine Day's cards. As you see, this is it may be elongated shape here, oval shape here, conical shape, spherical shape. This type of shape usually children have, and sometimes the normal heart has undefined when we couldn't say about oval or conical. So this is the all statistic I took from my searches about heart. Regarding the external features, in the heart we distinguish the base of this organ and the apex. According to location of the heart in the chest relative to other organs, we can find three surfaces in it. That is anterior or sternocostal. This is inferior. We call it also diaphragmatic surface. Left pulmonary and right pulmonary surfaces. The size of the heart. A long time ago, English physician Laennec, these doctors who invented the stethoscope, the special thing doctor use to investigate patients. And Laennec suggested comparing the size of a person's heart with the size of his fist. There are several main dimensions in the heart: length, width, and thickness. This is length. In the base, we see width, and thickness is a minimal size of the heart. Usually, it is from 7 to 8 centimeters. The idea of shape and size of the heart is of great practical importance. It means to understand and see and find the shape of the heart during examination of every person is important for common patient investigation. The weight of the heart, of the adult heart, is usually from 20 to from 200 to 500 grams, and usually it is about 0.5%, just a 0.5% of the body weight. Men heart usually more for women one, and as you see below. Then I would say that the shape of the heart, its size and mass are not constant values, and these characteristics change depending on a person's age, gender, lifestyle, and health status. The human heart, like all mammals, has 4 chambers. The 2 chambers of the heart into which the large veins flow, called the atria. We distinguish between the right and left atria, right and left atria. Another 2 chambers that push blood into the large arterial vessels are called the ventricles. We see right and left ventricles here. The atria communicate with the ventricles with the atrioventricular openings here and here. It means between right atrium and right ventricles we distinguish the right atrioventricular opening, and between left atrium and left ventricles there is left atrioventricular opening. In the clinic, you can often hear the term right head and left head. What does they mean? Right heart, refers to the right atrium and right ventricle. These chambers, located to the right of the heart axis, and contain, this complex, and it contains oxygen poor and dark red venous blood. The left heart, you see the red red complex, this one, refers to the left atrium and left ventricle, which are located to the left of the cardiac axis. These cameras contain oxygen-rich scarlet arterial blood. So we often draw these left cameras with the red color. If we consider the location of the cameras of the heart on a horizontal section tomography, this is the tomography on the such level of the chest, we see the right ventricle and right atrium that are located anteriorly, but the left atrium and left ventricles are behind right cameras. So don't be confused if you see such picture during computer tomography, and distinguish each cameras on such images. Couple of words about atria. The atria receive blood from large veins, and these veins we call cava, vena cava, and pulmonary veins here. Each atrium can be divided into 3 sections: venosus sinus. Usually it is the part of the atrium where veins flow in. Then the atrial cavity, usually this is main part here, main part of the atria, and small additional parts we call auricular. So we distinguish the right and left auricles. Total volume of the atria is not large. Usually it contains about from 40 to 80 milliliter of blood. Ventricles. This is the biggest cameras, and every ventricle has arterial cone. This is the part of the ventricles which connect to the large arteries here and here. And the second part of the ventricles is named the ventricle cavity. This is the largest part of the right and left ventricles. Total volume of ventricles is no more than 130 milliliters for right ventricles. As you see that the left ventricles is less than right one, and usually it contains not more than 100 milliliters of blood. Between the right and left ventricles is the interventricular septum. We call it septum interventriculare in Latin. And I show you this structure. And as you see, interventricular septum has two parts, membranosus part and muscular part. And you see that inside of the muscular part there is muscles, but the membranosus part is made from connective tissue, so there is no muscles there. And the defects of interventricular septum which may cause by normal development more often take place in this part, in membranosus part of the septum. Between left and right atrium there is the interatrial septum here, and usually in the centrum of this septum we find the small excavation round shape we call fossa ovalis or oval fossa. The topography of the heart is very important for doctors, and as you see, the position of the heart in the chest may be horizontal, and the angle between horizontal axis and the axis of the heart, usually it is from the basic to the apex of this organ, and this angle is small. Sometimes the heart may be like hanged in the chest, and such angle is the biggest one. And sometimes we see the oblique position of the heart. And this is more common for people. This is the oblique position. And the position and or retention of the heart in the chest is depend on the body constitution or body somatotype. In clinic and in anatomy, also, it is very important to know and be able to determine the skeletotopic boundaries of the heart. To determine the boundaries of the heart, the frontal silhouette of the heart and large vessels is projected onto the anterior chest wall, as you see here. This is a projection of the heart on the anterior position. And these contours is called the relative boundaries of the heart. We see such projection when we take X-ray examination of the heart in frontal orientation, and we distinguish right, left, inferior, and superior borders. The superior border, I mean here, runs along the line connecting the cartilage of the third ribs. This is the third ribs, as you see, and usually this is the superior border. The right border corresponds to a line, this line, usually 1.5 centimeters right to the right edge of sternum. I hope you remember this plain bone called sternum, and usually it is about 1.5 centimeters from the right border. Then to show orientation of the left border, we should to project the apex of the heart, and this point usually located in the left part, in the left half of the chest, and it is in the it is between 5 and 6 ribs. We call it intercostal space, and usually the apex located about 1.5 centimeters medial to the line. I show this line here, and this line is runs on the centrum of clavicula, another bone, clavicula, and in the centrum goes the path, the medioclavicular line, and between medioclavicular line and apex of the heart is about 1.5 centimeters, 1.5 5 centimeters. And then we can distinguish and show the left border between left third rib and apex, and usually the lower border, it goes from cartilage right 5 rib from this point to the apex. So it is very easy, and every doctor has to know and has to measure the borders of the heart in patients. As I said, the best way to see borders of the heart is to examine patients by X-ray. You see the woman with the internal organ of the chest, and we see the shape of heart. This is the shape of heart, and large vessels also. This is large vessels here and here. And you see the draft that show which vessels and which cameras are projected on the anterior wall of the chest. The right linear or right contour is the contour of superior vena cava and then right atrium. It means here superior vena cava, and this is right atrium. Then from the left side we see the shadow or contour of aorta, aortic arch. Then it is pulmonary trunk, then left atrium, and then left ventricle. The border of right ventricle usually is not good visible because it is projected together with diaphragm and liver, but just optionally we could show this border here. So it is very important to see and evaluate the border of the heart. Here, if we cross the mid-clavicular line, and this is the typical and normal position of the heart, normal borders, because during some diseases the shape and border of heart will be changed. The blood circulation in the human body run in the two big circle. We call them circuits. We distinguish small or pulmonary circuits. This is from the right ventricle. It starts from right ventricle with the pulmonary trunk, and then it divides into the two pulmonary arteries, left and right, for every lungs, and then it divided into the small arteries and capillaries. Then they combine together and form two veins from each from each lungs. So there are 4 pulmonary veins, 2 from the right lung and 2 from the left lung, and they flow into the left atrium where pulmonary circuits ends. The systemic or large circuits start from the left ventricle, and the main artery of the body called aorta. Aorta begins in the left ventricle. Then it go to different organs, to the head, to the limbs, to the organs in the abdominal cavity, where it divides into the small artery. Then small artery divides into capillaries, and then capillaries combine together and form veins, and all veins from the lower part of the body form the vena cava inferior, this one, and the veins from the upper limbs, head and neck form vena cava superior, and vena cavas flow into the right atrium where the systemic circuits or large circuits ends. This is very important knowledge, and I recommend you to remember these pulmonary and systemic circuits. Next, I'd like to talk about the heart walk, and this walk is the constantly it is it has 3 phases of normal cardiac cycle. The first phase, when we see construction of atrial, we call this phase atrial systole. Usually when atrials construct, they push blood into ventricles from right atrium. Blood flows into the right ventricle, and from left atrium it comes to the left ventricle. And duration of the atrial systole is 0.1 second. Second phase is called ventricle systole. You see this phase here and here, when muscle of the ventricles contract, and this phase during this phase, blood flow into the large vessels, as you see here. From right ventricle, it come into the pulmonary trunk. From left ventricle, it come into the aorta. And duration, time of the ventricle systole is about 0.3. And the end and the last phase, we call it common diastole. This is all of this period when muscles of the ventricles and atrium are not constructed at all, and this period when the heart rests. And usually it takes about 0.6 seconds. And this is very important. To rest, the period of resting should be longer than the period of work. That is the main idea. Even such as a hard worker as a heart usually have more rest period than longer rest period than walking period. And usually with such time of atrial systoles and ventricle systoles and common diastole time, we get that heart construct usually every second, and total heart construction or cardiac cycle, we see about from 60 to 80 beats per minute. That is a normal rate. And there are some structures in the heart which helps to blood flow in the one direction, and they are called heart valves. That is a universal structure in the physics, and sometimes in the pump, if you get some idea about working some pump, mechanically things that push the water, and you know that this electrical and mechanical engineering objects has special valves. Such valves we see in the human heart, and they help to move blood only in one direction. We distinguish two types of valves. That is cuspid valves between atria and ventricles. So because we have two openings between atria and ventricles, we distinguish the right atrioventricular valves and left atrioventricular valves. And another type of valves are located in the beginning of large vessels. in aorta and pulmonary trunk. Here is the valve of pulmonary trunks, and behind them, it is not good visible, is the aorta. Semilunar valves. We call such valves in the aorta and pulmonary trunk semilunar because they have special small semilunar valvulas. Here you see atrioventricular valves. In left cameras, that is, there are two cusps, and that's why we call this valve as a mitral. Mitral is some cap which for the legion person, and metropolite, maybe you know, and mitral valve is it is similar to this heart of the religion manager, let's say. And we often call this mitral valve as a bicuspidal or two-cuspid valve. In the right atrioventricular opening, we find atrioventricular valve which has three cusps, 1, 2, and 3. And that's why we call it tricuspid valve. Each cuspidal valve has cusps. This is cusps. It may be 2 cusps, it may be 3 cusps, sometimes it may be even 6 cusps. We see the tendinous chorda tendinous. This is like a fields from the marge, from the edge of each cuspis, and it connects to the muscles. We call them papillary muscles, and this is the processes from the ventriculus wall, and it is connected to the cuspis valves. When muscles contract, the cusps move into the cavity of the ventricles. You see also this fibrosis fields and structures called chorda tendina in Latin. Chorda tendina. And there are also few papillary muscles in the cavity of the right ventricles. Because of the muscles, we call cuspidal valves as active, because they have possibility to contract. Semilunar valves, there is no muscles. That is combined from the 3 cusps. We call them valvulas. And every semilunar valves has 3 semilunar cusps. They work as they look like some pockets, small pockets on the large vessels walls, and it is mostly by from endocardium. So this is just fibrosis connective tissue, which is just strong and stop from back flow of the blood. This is picture showing position of cuspidal or atrioventricular valves here, and this is the position and name of semilunar valves located in the pulmonary trunk and aorta. During atrial systole, when atrial contracts, the atrioventricular valves are opened and blood come into the ventricles. When ventricles contract, the cuspidal valves are closed, but semilunar valves are opened and blood flow into large vessels. That is all combination. One valve is open, two cuspidal valves open together, and semilunar is closed, and then when semilunar valves are opened, the cuspidal valves are closed. And when we take stethoscope, the instrument we use to hear everything in the body, we can listen to valves contraction, and it sounds like tuk 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 tuk. That is the sounds of working heart valves. Sometimes the cusp doesn't open normally, and that is a normal position when the valve is open, but that is a pathology valves, and we call this situation valvular stenosis. And here the valve doesn't open properly, and the blood flow is restricted. Another situation when the valve is not possible to close properly, and there is some gap between cusps in closed position, and then blood flow backward, and we call this situation in clinic valvular insufficiency. So there are two main problems with valves: stenosis, when it is when the blood through the valve is restricted, and valvular insufficiency, when the blood flows back to the camera, and that is also not good. And sometimes you may hear about mitral valve prolapse. What does it mean? You see on this picture, when mitral or tricuspidal cusps come back into the atrium, and blood flow back from ventricle to the atrium. That is not insufficient because the cusps are normal. It sometimes happens when the length of chordas are more than they should be, and it come to the mitral valve prolapse. You may hear about it in clinic. Which layers has the heart? There are 3 layers. External layers, it is covered with mesothelium, and these layers we call epicardium. Epicardium. It means it's located external. And this layer contact with the pericard. This is a special cover of the heart, and between epicardium and pericardium there is a cavity, this one, with the fluid which restrict or decrease the force of bremsen of form of that is help to move easily. It helps the heart to move easily. The internal layers here is named endocardium, and this is the internal layers which contact with blood. But the thickest layer here is the main layer of the heart called myocardium. And it consists of cardiac muscle tissue. You see this tissue here, and that is special muscle tissue in the body which has separated cells with the cross section, and so we call it cardiac muscular tissue. More knowledge you get about cardiac muscular tissue you get in the histology in our department. So there are 3 layers: epicardium, endocardium, and myocardium, the main layers. Endocardium is the layer which is used to form valves. But myocardium works all the time, and we distinguish 2 myocardium layers in the atria, I mean here and here, but 3 myocardial layers, it's visible there, in ventricles: external, internal, and intermediate or middle. So there are 2 myocardial layers in atrial and 3 myocardial layers in ventricles. Usually the thickness of myocardium is different. The large myocardium we see inside of left ventricles. Usually the thickness of the left ventricle wall is about from 10 to 15 millimeters in normal heart, but the thickness of right ventricles, you see, it is thinner, and it is about from 5 to 8 millimeters in thick. It means that the different ventricles works different. The the hardest work is for ventricle, because it serves for systemic or large circuit. But for the right ventricles, the work is easier, and that is the beginning of the pulmonary or small circuit. Myocardium, this layers which contracts, and it was the good known fact in history, but later scientists found different cells in myocardium. I show these cells and called them conductive cells. So normal cells, myocardial cells called contractile. They sometimes are called as a typical, but conductive cells are named as atypical. So, and they conduct electricity. They don't contract, and they generate electrical impulses and conduct them to other muscle cells, to typical cells. And combination of these cells are called conductive system of the heart. And you see the picture of conductive system, which has a special anatomy and special location of some parts of conductive system called nodes. There are two nodes. One is a sinoatrial node located in the end of superior vena cava, between superior and inferior vena cava, in right atrium. And the second node, called atrioventricular node, is located in the mostly in the right atrium, between the right atrium and right ventricle, close to the interatrial septum here. This is a special triangle. Usually it is visible, and that is the point of atrioventricular nodes location. Between nodes we see some bundles. We call them internodal bundles, and that is the way of electrical impulses from one node to the second one. Then from the atrioventricular node starts atrioventricular bundles. Another name is His bundle. This is a His bundle, which is divided into the two branches, right and left bundle branch, which divided into the small fibers, connective fibers, and provide electrical signals, electrical impulses to the right and left ventricles. Take in consideration that contraction and pathway of electrical impulses for atrium go from the base part of the heart to the apex. This is the direction of contraction, but mostly for ventricles it starts from apex and go up to the atrium. This is the typical phases of contraction because of such anatomical organization of conductive system. Here visible the process of impulse movements and again you see that the direction of impulses is go from atrium to the ventricles, and then from the apex of the ventricles to the atrium. And registration, it is possible to register these impulses, and it is electrocardiography, which is very popular examination of patient in clinic. It's visible every conducting structure is responsible for special parts of electrocardiography. This is a common picture, common diagram of the electrocardiography during one heart phase, and this is all of show which part of conductive system is responsible. And also now we distinguish special medicine program which help to treat cardiovascular problems, and this is very good because a lot of problems with the conductive system may cause the death of patients. Now special equipment implanted in the body, and some of the cords connect to the this is the electrodes, we call them, are inserted into the heart, and electrical signals go to these electrodes and help the heart to contract, and it saves lives a lot of a lot of patients. Pericardium is the external layer. It is not layer of the heart, but it is the different covering, which decrease the problems when the heart moves. The moving, it make moving of the heart in the body easier without and pericardium, when it is flow with the blood during infarction, it called heart tamponade, because it looks like the heart pumps the blood into the pericardial cavity, and it contracts the heart, and it makes impossible to walk, and this is the cause of the death sometimes. Couple of words about phylogenesis of the heart. If we take a look of the small animals like Lancetnik, this is, we will find just only pulsating vessels. There is no heart in such animals. Then in pieces we find two cameras, a ventricle and atrium, only two cameras in pieces. Then amphibians has three cameras, one common ventricles and left and right atriums. So it means that there is the mixing of oxygen and non-oxygen blood in the common ventricles. Then in reptile start to form two different ventricles, left and right, but sometimes the septum between them is not accomplished. So and also we observe the mix of the blood. But birds and mammals has four cameras like human, and that is separated right and left ventricles from each other. Ontogenesis, usually it takes repeats the phylogenesis started from the when it is look like one vessels, then it has some of the enlargement of this tube and form flexion of these tubes and form, as you see, red ventricles, red color ventricles, and blue color atriums, and also form two big vessels, aorta and pulmonary trunk. And that is process of dividing heart into the three cameras and forming the interventricular and interatrial septums, here visible, forming interatrial septums. It goes first, and then in a little bit late forms the interventricular atrium forms. During fetal period of life, some of new structures forms between septum interatrial, between two arteries, the oval openings forms, And then also, because the lungs doesn't work in the fetal period, the vessels between pulmonary trunks and aorta forming that help blood to flow out of lungs, and this is the fetal circulation. And then after birth, the opening between atrial is closed. Usually it takes place after 6 months after birth, and also during one month after birth, the ductus arteriosus or bottle of ducts is closed also. It is first, then closing of oval opening taking place. Sometimes it comes follow to the anomalies where something goes wrong. There we find anomalies or malformation of the heart. That is not more than 10% of all congenital pathology or congenital malformations, but because the heart is the main organ, this anomalies is really difficult to survive. According to the clinical classification, we distinguish defects or malformation with cyanosis when the skin is blue, and without cyanosis when skin is pale. We call them pale defects and blue malformations. And according to anatomical classification, we distinguish anomalies of position, of heart position. This is number one. The malformation, isolated malformation on defects, and combined heart defects. Let's see some of the heart position anomalies or malformation. This is acardia, when there is no heart in fetus. Of course, that is the state when the fetus has no chance to survive, no life. This is a dystopia of the heart, when it is located on the most right position. Sometimes it is located pre-sternal location, when sternal was not formed, and heart may located under the skin on the anterior wall of the chest. Isolated heart defects. The most most not popular, but doctors very often can see such defects, called called atrial septal defect. This is the place in between two arteries where is located oval opening during fetal period of blood circulation, and sometimes it is not closed, and we see the defects inside of, and surgeon needs to close this opening with special artificial materials and special artificial mechanical prosthesis. Another isolated defect is ventricular septal defect. Maybe you remember reptiles, and they have common ventricles, and this is a defect in the membranous part of interventricular septum. And so it means the blood come from the left ventricles to the right ventricles and back, and that is the problem which the non-oxygenal and less oxygen and rich oxygenal blood are mixed together in ventricles. Then the third problem, third defects, is the opening of bottle of duct between pulmonary trunk and aorta. So this is typical for 50% of all defects of heart, all defects. And sometimes we find transposition aorta and pulmonary trunks. So or sometimes that is combine arteriosus trunks when dividing aorta and pulmonary trunks is not completed, and then such as a common arteriosus truncus we see in patients, in children mostly. Sometimes such as common trunks located between left and right ventricles, and it's also combined with the ventricular septal defect. Another way, no possible. And combined heart defects, the most often called Fallot's tetralogy. It has four symptoms: narrowing of the pulmonary trunk, defect of the interventricular septum, dextraposition of the aorta, and hypertrophy of right ventricles. It's visible here. This is a very difficult disease and malformation another way, and usually without surgical operation children couldn't survive. So now in St. Petersburg there are at least 2 centers where such an operation performed. That is all for now, my friend, and I'm ready for the questions today. If you have questions, please let me know. Let me remember you that as usual you have to take a test regarding heart anatomy today, and you will find this test in Moodle as usual. If there is no questions, let me thank you for your attention, and as we will see each other 2 weeks later in our lecture course. Thank you for all students being who were together with me, and wish you good weekends. See you. Goodbye.